system.
And you've spoken at length about the power of technology. What do you feel are the constraints within that? Is it capital investment? Is there cultural elements that stop you from making the progress that you'd like to? What are the challenges within moving that forward and implementing?
I mean, I think the biggest challenge is twofold. Firstly, spreading those innovations right across the system. I think we know what kind of innovations we want to make in terms of technological changes in the immediate future. Spreading them across the system is the first challenge that we face, and we want to make sure that happens. But then I think the more profound issue which we need to confront, and which is important to making the best of any technological innovations, is to make sure that trusts and providers right across the country are reshaping the way their services work, reshaping the systems around the new technology. What I mean by that is that if you have healthcare being delivered in a certain way now, and you just layer on top a new technology, that might have some benefits. You know, it might have some improvements to the service which is being provided, or make it more efficient in terms of productivity. But it will miss a lot of the really big productivity gains that you could gain from transforming the service around that technological innovation. And that's actually the harder part, because I think if you just layer a new technology on top of business as usual, you'll get some benefit. Thinking about how business works and restructuring that around the new technology, that's the harder part, but it's where the really big gains can be made.
And in your view, is that the main route to productivity gains? What are the other elements that you feel will support that transformation?
Yeah, I think productivity gains from technological change are the really big prize in front of us. We can see, if you look at how AVT, ambient voice technology, is working in so many places across the country, really significant reductions in time clinicians are spending on the front line, having to make notes, a real increase in the time available for them to speak to patients, increasing the rate at which they can speak to patients across their shifts. That's a good example of a technology where the productivity gains are really significant. But actually, to build on my earlier comment, if we simply layer on AVT across the health service, we will make productivity gains. But if we start thinking how we can reshape the service around it, that's where the even further gains can be made. And one of the first things I did in this role was the second reading of the NHS modernisation bill, which is going through Parliament at the moment, and that includes the enabling legislation for the single patient record. Now, the single patient record is a good example of a technological change, a digitisation of records, and making connections between the records, so records across the system can all be seen from one place. If we just do that, there will be benefits, because it means that we don't all have to tell different healthcare professionals the same story multiple times. It means that things are much less likely to be missed, because any clinician can see records from the GP surgery, from various different hospitals and so on. But that infrastructure of a single patient record then allows you to build really big changes on top of it by changing how the system works around that connection of data, and that's where the next stage of productivity gains and better delivery, I think, lies.
Thank you very much, Secretary of State. We've got just a little bit of time now for some questions from the audience.
Great, thank you.
So I'll take one over there, one from there, and one from over there. Over there first, thank you. Yes.
Hi, Sean Muller from Daily Mail. So we can get an idea of the timescales you're working to. Do you expect or want to be Health Secretary under Andy Burnham? And then secondly, looking at the Ockenden review yesterday, you've said that you will compel future leaders to engage with inquiries or they'd risk a prison sentence. Can you commit to draining the swamp of those that have refused to engage with previous inquiries or are responsible for failings in the health service, and then fire those that still remain?
Well, thanks for your questions. And on your first question there about Andy Burnham, I'm backing to be the next leader of the Labour Party and to be the next Prime Minister. I know that he's got an amazing track record in Manchester in terms of health, as well as in terms of public transport and growth and investment, and I know he'll bring that drive and that focus to his work in Downing Street. Obviously, any decisions about cabinet or other ministerial posts are for him to make. Wouldn't be for me to make suggestions to him in that regard. But I'm loving doing this job, and I've made sure that getting into it, we haven't lost a second in terms of pushing forward with our agenda of delivering better services and better NHS for patients, and making sure that we're driving that transformation which I've been speaking about today. On your second question about the Ockenden report, which was published yesterday, look, last week I went and met a small number of the affected families in Nottingham, and it was incredibly hard for them to relive their trauma, to share their stories with me, having shared it so many times before. I found it numbing to listen to their pain, and then, as I said in my statement yesterday, to then recognise that their pain is multiplied so many times beyond. Some of the priorities of the families I spoke to are around changing the way maternity and neonatal services work, but also around accountability. And that's why the issue around accountability and senior clinicians not taking part, not giving evidence to Donna Ockenden's review, I think is so unacceptable and has caused so much upset to the families involved. And so that's why I committed yesterday that we will implement the duty of candour, which will be brought in by the Hillsborough law when that's in legislation. We will apply that to maternity reviews in the future, so that when maternity reviews happen, for instance, the two which are coming up in Leeds and Sussex, people will not be able to refuse to take part in that, because I don't ever want to have a situation again where NHS staff, past or current, can refuse to take part. They have to take part to make sure we can get that accountability and justice that the families deserve.
Thank you. We'll take a question from over here, and then two from over there. We'll take them in threes.
Hi, thank you, and thank you for taking on the job, and getting to grips with it so quickly. I'm Jenny Edwards from the People's Health Trust. The government set this amazing and impressive ambition of halving the health inequalities that currently are 20 years of healthy life expectancy. How do you think we're doing? And what do you think is most important in doing that? Just to add on to the end of that, and will you engage with communities who know a lot about what that means to those lives and the communities that are blighted by it?
Thank you. No, thanks for that question. And I think, sorry, do you want me to?
No, it's fine. I could take a couple more, and then maybe you can.
Okay, sure. Yeah.
Just lady over there, please.
Hi there. I'm Alex. I work for Alzheimer's Society. My question is about avoidable hospital admissions. So 1 in 6 people in a hospital bed have dementia. With your both DHSC and Treasury hat on, I wondered if you could speak to what more can be done to kind of unlock cost savings from preventing avoidable hospital preventing avoidable hospital admissions. Thank you.
We'll take this.
Okay, those two. Sorry. I was making a list so I don't forget them all, but I can just about remember those two. So on the question about health inequalities, one of the things that has really struck me about getting into this role is the degree to which health is determined not by the NHS, but by everything else in life. And it's a real privilege to sit down with Chris Whitty, who explains all of the statistics and all the data around this, and shows just how much different factors in people's lives impact on their healthy life expectancy and on the likelihood they have of having various diseases or illnesses throughout their lives. So I think for me, the shift in the 10-year health plan from illness to prevention, making sure we're preventing people from getting ill in the first place, is absolutely crucial to making sure not only that the NHS is sustainable in the future, but also to truly improving the nation's health. Because the NHS is such an important thing for all of us that quite often discussions around health talk just about the NHS, but really there's so much more we can do in terms of preventing people, helping people prevent themselves from getting ill in the first place, And that's where I think a lot of those questions that you're raising are most important. I think there's also that question of equality, because we know that in terms of healthy life expectancy, in terms of access to different good quality food and all the different determinants of people's lives and their healthy life expectancy, that varies a lot by different factors in society. And so, as well as being a health question, it's also an equality question more generally. So I really think that my vision of how we should make the population healthier is by thinking not just about the NHS, as absolutely central as that is, but it's also about how do we prevent people becoming unwell in the first place, and really take a step back and think about, well, what about bad housing? What about air quality? What about mental health if people are out of work? We should get more people into work so they have better mental health. All those kind of parts of people's lives are really important. And some of the structures which are coming in through the legislation that's going through Parliament at the moment will help with that, with ICBs being more closely connected with mayoral authorities, who then have remits over housing and transport and so on, to try and have that link up between the wider determinants of people's lives and health, rather than just the NHS and health, I think is the way to tackle the issue that you raised. And then on the question about avoidable admissions to hospital, I think when we talk about social care, we quite often think about people who are living in either a residential social care setting, or they have social care coming to their home and looking after them in that way. The other part of social care for me is to try and make sure people have that help when they need it to prevent them going into hospital. And that's the part for me that can help not just the people who are directly affected by frailty or by illness, but it can also help take some pressure off the NHS. So for me, that focus on social care and neighbourhood health care, trying to help people avoid going into hospital in the first place, is really critical to taking that pressure off. I often think about it as a sort of upstream and downstream, either side of hospital. Upstream, we want to prevent people going into hospital in the first place. Downstream, when people have been attended to in hospital, want to make sure they can leave easily and they have the care they need to do so. So that's why my focus on neighbourhood healthcare that I mentioned at the beginning is so important, because if we can help particularly people who are frail or elderly from needing to go into hospital in the first place, that's a huge benefit for them, but also for the NHS.
Thank you. So we've got time for just 2 more questions. I'm going to go right to the back over there, lady, and I'll take one from over here, please.
Hi there, it's Lauren from the social innovation charity Nesta. My question is, the 10-year health plan was published. I think we're nearly at the year mark now. I think it's very, very soon. And within that, there was a commitment to end the obesity epidemic within that. I was wondering kind of what your plans are to kind of push that forward, get those commitments out there, because we're yet to see kind of much progress on some of the commitments that were in that.
And gentleman over here.
Thank you. I'm Eric Salem, Director of Policy at GSK and formerly DHSE and Treasury as well. Just building on what you were saying before on prevention, I'm really interested to get your thoughts on, I think the macroeconomic case for investing in prevention and population health, it's been well think-tanked and there's lots of evidence out there now. What, in your view, is the way to kind of make this a whole-of-government priority where, say, the Treasury and the OBR really believe, this is really, and this can really move the economic and fiscal position? They've seen use cases and opportunities, I think, around talking therapies where that can make a real difference. So how actually do we get this belief in the centre of government to really sort of help drive this in the way they allocate resources as well?
Great, thank you. Well, thanks very much for both those questions, and in a way they link together because if we can tackle obesity, that's one of the key ways of helping to prevent people from being unwell in the future. And I think it's a right view to say, look, we need to make sure this is a whole government approach, because it's not just about the NHS, or it's not even just about the Department for Health and Social Care to make sure we're helping people to live healthier lives. It includes, as I said earlier, housing. It includes people being able to get into work. It includes people eating more healthily. So I think the prevention agenda is one that we have to address as a whole government, and not just at the national level, by the way. I think one of the really big benefits we can make in the coming years is to focus on devolution and giving more power to local areas where healthcare is delivered, but also where some of the other determinants of poor health, like poor housing or like people being unemployed or not having access to open spaces where they can go out and have exercise, all of those are really local issues as well. So I actually think the devolution agenda links up very well with the preventative agenda. And I'm someone who, I come from a background of 10 years as a local councillor and then nearly 4 years working at City Hall in London. And I felt then that at the local level, there is a lot more understanding of how to improve people's lives through the determinants of what can have an impact on them, whether that's their housing or their job prospects and so on. Some people said to me, well, once you're a national politician, you'll forget all that, won't you? But I can say absolutely I haven't. I think it's ingrained in me to focus on that devolution, to have that power going down to people on the front line. So through what we're doing in the NHS modernisation bill, with more power at ICBs, and with ICBs then being linked up with mayoral strategic authorities, and with that focus on the wider determinants of health, I think that's where the preventative agenda has great gains to make.
Thank you very much, Secretary of State, for your time and insights. I think that's a wrap-up for the amount of time that we've got with you today. So thank you very much for your time. Thank you very much for your insights, and thanks for all the work that you've done so far.
Thanks very much. Thanks for having me, Lauren. Thank you. Thank you.
Thank you, everyone. So all that's left is, for me, Harry Coulson, I'm the Director of IPPR, to say thank you to everyone for joining us today. I know our Chair, Victor, kicked us off. I'm less knowledgeable on health than him, less handsome, less charismatic, so probably a bit of a downgrade. But nonetheless, I'm delighted to be here, and I'm delighted you've joined us today. I'd like to thank all our keynote speakers and our panel speakers, who are all excellent. I'd like to thank our events team, particularly Holly, for stewarding today's event, and to Seb, of course, our Head of Health, who has put today's programme together. And also to our sponsors, so AbbVie, the British Heart Foundation, Gilead, Haleon, MSD, and Sandoz. Without the support that those organisations provide, we wouldn't be able to do the work we do. We've had a really interesting set of debates here today, and I think they point to the